shortly. We have a few people still logging onto the system. We do have a full hour planned of discussion today, so we'll begin in just a few moments. Thank you. Good afternoon, everyone. We are going to begin. For those of you who are joining us, my name is Aaliyah Samuel, and I am the Education Division Director here at the National Governors Association. We appreciate you taking time out to join us on this webinar today. We understand that school safety and prevention have certainly risen to become a priority in many states. And so recognizing that this issue of school safety and prevention is certainly one that not any one individual or organization can resolve, we wanted to bring our three divisions together that provide support in this particular area to be able to talk to you about the types of resources and supports that we have, but also be able to hear from you regarding some of the challenges that you might be grappling with, opportunities, and be able to develop our supports accordingly. So how we plan on utilizing the day today, or our time together today, is we have representation from each division. But who you will hear from directly today is myself representing education. We actually have had one change from the health division. We have Hammy Towerson with us today. She is the director of the health division. We'll also hear from Alicia Powell, who's the program director for Homeland Security and Public Safety, as well as Jeff Locke, who is a program director for Homeland Security and Public Safety. We also have Akisa Coleman here, who's a senior policy analyst for the health division. And we will have an opportunity to speak to you individually about how our different divisions are providing support. We also have a guest speaker, Paul Fennell from the National School Safety Alliance, who will be able to give us a national perspective on this particular conversation. And then we have our listening session, which is where we'll really turn it to all of you state experts to be able to provide us some information regarding the direction of this conversation in your state. At the end of the call, we have a very short poll that will be distributed via email to all of you that will provide you an opportunity to click on the different types of supports that you may or may not be interested in from each division. And so we'll post those at the very end. Throughout the webinar, there'll be an opportunity for you to either ask questions. There's also a chat box. We are controlling the mute on our side just to be able to control some of the background noise. If you would like to ask a question or make a comment, if you raise your hand, it will pop up on our side and we will unmute you from there. You can also type directly into the chat box, or you can email your question to education@nga.org, and that comes directly to our division, and we have somebody monitoring the inbox, so it's real time. So there's 3 different options that you can utilize. So here you'll see a picture of each of our team members across the divisions who are providing support on this particular topic, along with their email addresses. Since we had, Sandra is actually out sick today, and so you are still able to email her if you have additional questions, but we do have 2 members from the health division here to triage questions today. So with this discussion on school safety, we are working on developing a framework, recognizing that there really needs to be a holistic approach to the topic of school safety and prevention. And so what you have in front of you is how NGA is really approaching this issue. You'll see school safety and prevention at the center, with supports from all 3 of the divisions. And so what we would like to do is just have a high-level discussion on how some of the supports that each division is bringing to this conversation. So from the education perspective, one of the things we've heard from many states, we've had team members in actually 5 states in the last 7 days. And as the school safety discussion has been elevated from the education perspective, one of the things that we have heard a lot is looking at family supports and really the whole child, looking at social emotional learning, some of the positive behavior supports, and really some of the in-school interventions that can be attempted. And so we are going to continue to build out that work. And as we complete our framework on school safety and prevention, we will go into greater detail. I'm now going to turn it over to Alicia Powell and Jeff Locke to provide a little bit of background regarding the work that the Homeland Security Division is doing to address school safety and prevention.
Thank you, Aaliyah, and thank you all for joining today's call and allowing us a few minutes to discuss how the Homeland Security Program at NGA has worked on the issue of school safety. Just as for context, in my program, I oversee all of our work on Homeland Security and emergency preparedness. As a result, I work most closely with your governor's Homeland Security advisors. As you may know, your governor appoints one individual to serve as the Homeland Security advisor, which means they serve as the primary liaison to the U.S. Department of Homeland Security. But more importantly, they are also responsible for implementing the Homeland Security mission in your states. And although these missions vary, they all have a common theme of working to minimize loss of life and damage to critical infrastructure by preventing, preparing for, responding to, and recovering from natural, man-made, and technological hazards. Many HSAs have included school safety as one of their top priorities, whether in their Homeland Security strategies or in their risk assessments that they conduct every year. So I just want you all to know that this has been a priority for our Homeland Security advisors for quite some time. And in terms of the work that we've done specifically with states, most of that started following the tragedy at Sandy Hook Elementary School. Much like you all are doing here today, the HSAs began to have a series of discussions on school safety and the lessons learned following these tragic events. And although our initial foray was because of man-made incidents, I do want to point out that the HSAs do focus on things from all hazards, as I mentioned before. So not just man-made, but natural disasters, especially no-notice events such as tornadoes and earthquakes, as well as any technological hazards. So following the many discussions and lessons shared among the group, the HSA has tasked my group with actually conducting a survey and trying to get a better understanding of school safety in the states, how it works, what's the environment. So in that survey, we asked questions such as, who is the lead agency for school safety? Does the state have laws on the books about developing emergency operation plans? And where are they getting funding to support school safety activities? So that was the ability to give them the national picture of what states were doing, but also increase their understanding of all the different connections in this space. I'm happy to talk more about the survey and Q&A, but I just want to leave you with 3 takeaways about how you can collaborate more with your Homeland Security and emergency management offices. First is funding. I'm sure that's always the first question people ask about, how do we build more capabilities. And although funding in the Homeland Security space has been reduced, like so many other areas, some state Homeland Security offices do dedicate their funding from the Department of Homeland Security to help with school safety items such as purchasing equipment or helping the supporting emergency operations planning. Speaking of emergency operations planning, the state Homeland Security and emergency management offices have deep expertise in developing these emergency operations plans, and they can provide technical assistance to schools to help them build out those plans. So whether they are developing them for the first time or looking to update them, the Homeland Security and emergency management offices can provide expertise as well as make sure those plans adhere to national standards, which only helps to ensure a coordinated effort to response when emergencies occur. Last but certainly not least, each of you has what is known as a fusion center in your state. These are state and locally owned information sharing hubs that receive, analyze, gather, and share threat-related information. Fusion centers across the country have provided support to schools by conducting threat assessments and receiving tips about school-related threats. Many of the HSAs oversee these fusion centers, and they can work with you to better understand what the threats look like within your state's picture. So with that, I'm going to turn over to my colleague Jeff Locke to discuss the public safety program's perspective.
Great, thanks, Alicia. From the public safety side of the house within our division, we support state public safety secretaries, as well as a network of criminal justice policy advisors who may be getting brought into these discussions. I see at least 9 of you or so on this call here. As you know, we provide technical assistance and convene discussions around safe handling and storage of guns, as well as risk-based gun removal laws. But I did want to put in a note here just to ask for a hold on gun-related questions for this webinar, as we'll be convening a joint call with our Homeland Security advisor colleagues, as well as state public safety secretaries and criminal justice advisors that are open to all governors' advisors as well on March 22nd. And we'd love to kind of pick that issue up there. And so just thanks for this opportunity by the Education Division, and we look forward to the discussion.
So at this time, I'd like to turn it over to Hammy Towson and Akeisha Coleman. Sorry, our senior policy analyst for health. They are going to speak to some of the work from the health division on this issue.
Great, thanks. Thank you, Leah. So glad to be joining this conversation. Unfortunately, I think part of the conversation needs to focus on behavioral health. And here in the health division, we have extensive experience with working with state leaders on that. You know, we primarily work with the health policy advisors in your state. And we can tell you that for the past couple of years, behavioral health has been one of their top priorities, and we've had a number of projects around that. And, you know, Sandra Wilkness, who was sick today, is a clinical psychologist on our staff, and Akeisha Coleman, former social worker, really have had extensive lots of experience thinking about behavioral health interventions, figuring out trauma-informed care, linking with community supports, home visiting programs, and really wraparound services for children and families. And I can tell you, for the past couple of years, we've thought about also partnering with schools and thinking about how you can think about assessing children who are, the term can be at risk, or another way to put it, and really then linking them to the supports on the health side and the community side to really effectively improve their outcomes. So we really are pleased to be part of this conversation. I think it's going to be an important component of what we discussed today.
Thank you, Hamie. And I do want to say that to mention that this conversation is one of many. This particular webinar is the kind of laying the groundwork for us as NGA and the cross-divisional building of a framework to address this issue. Over the course of the last week and a half, our team members have been, like I said, in 5 states, and we have heard varying conversations. In one particular state, they had $9 million allocated to school safety, of which they now have $4 million left. Those initial funds were really used to look at the safety of the facilities, but now, because the comment was, we've pretty much done everything we could to address the facility safety. Now we want to turn to in-school supports. And we recognize that right now states are approaching this conversation from very different lenses, from the facility safety to in-school supports for students and teachers, to also looking at supports for families. And so we are not going to develop a one-size-fits-all approach or framework, but really recognizing that the conversation is at different points with different focal points throughout this piece. And so this conversation will really help to inform us and how we should build and guide this work. So with that, I'd like to introduce Paul Fennell, who is the Senior Policy Advisor for the Missouri Center for Education Safety. He is at the National School Safety Alliance, and he is going to be speaking to us about the national perspective on this discussion. And so I would like to turn it over to Paul. If you have questions for Paul, either throughout his presentation or afterward, please feel free to utilize either raise your hand feature, the chat box, and or the education@nga email address, and we'll be monitoring those and collecting those questions throughout the webinar. So Paul, thank you very much for joining us today, and you are unmuted and have the mic.
Okay, thank you, and thanks for allowing me to be a part of the webinar and the conversation today. I want to especially thank Dr. Samuel and also Alicia Powell, who I've networked with for a number of years now, and having visibility on the great work that NGA does. Again, you saw my bio there, but just a real quick background. The perspective I bring is that I spent about 23 plus years in federal law enforcement. I then retired from that and took over Missouri's Homeland Security program, where I served as the director of the Office of Homeland Security for a little bit over 6 years. While I was not the Homeland Security advisor, more often than not, I was acting in that position. So I got to a number of the national meetings and a lot of the interaction with the other state Homeland Security advisors under the NGA's program supporting that. And that was a great program. And actually, I think probably helped me mature and develop a perspective of how collaboration and allowing grassroots organizations to drive things was a lot better than allowing at the national federal level some of these different programs to drive the conversation and drive funding and things like that. Then I retired from the Homeland Security program, and I took over as the director of the Missouri Center for Education Safety, where I did that for 6 years. That was a public-private partnership between the state Department of Public Safety that had some Homeland Security money available for the program, as well as the Missouri School Boards Association, which was all about home governance, local community governance for schools, and they stepped up to be a partner in school safety. And so we try to take, I know NGA talked about the holistic approach in our Center for Education Safety. While some states focus only on specific narrow programs. I know, like for a period of time, Montana had a center where they focused only on suicide prevention. In Missouri, we try to take the stance that we want it to be broad, covered kind of a multi-hazard type focus, and then serve all schools and all children in our state, both schools going to public schools, but then also schools that were private. And so that was where we went. We started the National School Safety Alliance in the spring of 2014. One of the things within a year or two taking over as the director of the Center for Education Safety, I realized that while the federal programs, the Department of Education and the National Institute of Justice Comprehensive School Safety Initiative, while they shared information, it was kind of a haphazard, and there really wasn't a solid framework on how federal agencies shared information back and forth with each other and deconflicted stuff, and then got it down through a systematic program down to the local schools. And so I started to reach out to a number of the other states that had school safety centers initially, and then eventually trying to identify someone in every state that had a point of contact for school safety. And then we started in the spring of 2014 to hold monthly telephone calls using a conference call line, and then the Homeland Security Information Sharing Network, their Hiss and Connect virtual meeting room. And that seemed to work out pretty good, and we've been ongoing with that ever since that time. With always the first Monday of every month, we hold a phone call and use the virtual meeting room to talk about relevant topics and to share information. Some of the things as far as the mission of the National School Safety Alliance, it's to promote a national school safety framework that's basically driven by the grassroots states, making sure that the states were clearly in that pathway, that framework. Again, I indicated before, and I'll talk about it here again in a minute, the fact that quite often the federal agencies have kind of taken the strategic plan or the policy that they're going to communicate directly with the local school districts. And while that's noble, and I don't think that there's any nefarious intentions there, that sometimes is fragmented and broken. As you know, it's almost impossible to maintain a database down to the community school level that's going to stay accurate month in, month out. That would take a Herculean effort on the part of one federal organization to do that. To me, it made a lot more sense to have a point of contact in every state for the federal agencies, and then use that as your gateway or your segue into the community school districts. And so as you see on your screen here, we've got a map there. We've identified, and we've got resources through the National School Safety Alliance that members can, or you can go to a website and you can click on any one of those blue dots on that map, and it will tell you who the point of contact is for that state. There's also a number of other links on this page here. We've tried to maintain a reference library and a resource page where there's some best practice guidelines and documents, rather than somebody having to go out and spend a long period of time searching the internet, trying to figure out what are good resources, what aren't such a good resource, trying to vet some of this stuff through our subject matter experts, and then putting that in a reference library. Again, one of our focuses is we wanted to make sure that we're consistent and comprehensive in information sharing, and then inclusive of all the state and all the federal stakeholders. Again, while there's a number of primary federal stakeholders like the U.S. Department of Education and then the National Institute of Justice Comprehensive School Safety Initiative, there's a lot of other partners out there at the federal level that also have an interest and a stake in school safety and have information to share all the way down to the local school district level, but it also should be in the pathway that the local school district level could give them information back up to those agencies as far as are there other programs that they need to help develop, or there are other issues that need to be resolved or looked at or illuminated. And so it's a two-way information sharing thing. As you see on the slide here, again, I've got a number of the federal agencies there that are shown. And again, there needs to be, and it's not where it needs to be yet, but there needs to be synchronization back and forth between all those different federal agencies. There ought to be lines like a spider web up there at the top between all those different agencies, coordinating, synchronizing, and deconflicting information sharing. And while that's happening to a certain extent, it's not happening across the board. And I like to say that, again, that's not nefarious or it's not intentional. It's just the way everything is. Again, when you're an agency, you're fighting for budgets, you're fighting various political, bureaucratic battles, and you're basically going into your office and every day fighting that tree that's in front of you. It's really hard to see all the other trees in that forest there and figuring out how they relate to your tree. And so the other thing then is, again, if you go back to the previous slide, please. Again, the default right now is, I know, for the Department of Education and NIJ to try to work a lot with local school districts. I know NIJ has this comprehensive school safety initiative, and they've had grant programs in the past where they pretty much market that down to the local school district level, and that's noble. But the problem is the word doesn't get out to an awful lot of school districts. If you happen to be a large school district that has somebody dedicated to chasing grant opportunities, or maybe a university that has the opportunity to chase grant opportunities, they take advantage of a lot of these grants. But there's an awful lot of schools that would probably benefit greatly from some of those grant programs that don't even know about them. And then also the product out of those great program, the grant program, some of the best practices programs that are identified through that research, that information doesn't get out to where it needs to at the local schools either. I know there's a resource, like, I don't know how many of you are aware of it. NIJ has a resource where they have a database of evidence-based best practices. And if you want to find a best practice program for a positive behavior intervention support or school climate, if you want to have a best practice program for behavioral risk assessment, an anti-bullying program, things like that, NIJ has that database that you can look at all the different programs that have been researched and find out what the results of that research were. So you can identify a program that's appropriate to your organization and that truly is the best practice. The problem is very few people know about and use that resource. So one of the objectives of the National School Safety Alliance, again, through our collaboration with all the other states, trying to get the word out to everybody, and then looking at those state school safety centers or the point of contact within that state to then to get that information down to the local school level. To me, that's a sustainable strategy if we can get a framework built in this country that has right in the middle of that information flow pathway the states. That's where it's got to be. I think leaving the states out of that information flow, and again, maybe it's not intentional, but it really causes problems in that you really don't have a lot of consistency. You don't have that holistic approach, again, that NIJ talked about, or the National Governors Association talked about at the start of this program here. And so could you go on to the next slide then again, please? Again, the whole idea is to synchronize and make sure that we have a comprehensive program and that we're deconflicting stuff and sharing information. And the way that works, again, when we have our call every month, we first of all let the federal agencies that want to participate. I always invite U.S. Department of Education, the National Institute of Justice, FEMA, and anyone else that wants to participate. We let them go at the first part of the call, talking about stuff that they have going on, upcoming training programs, upcoming grant opportunities, things like that. And if they have any read-ahead material, they send that to us. We put it in the Homeland Security Information Sharing file share pod where people can download that. When I send out the agenda each month for the meeting, if I have read-ahead material, I'll send that. And then we try to capture the information that was discussed during the meeting and then send that out as a recap after that meeting takes place. Like, I know we had a meeting this last Monday. Last night, 10 o'clock at night, finally got the recap out. And again, in that recap, we include what was discussed. If people send me the information kind of in a synopsis, we send out other documents with that recap. And it's a good way to make for sure that all states are sharing that information. While I only have about half of the states actively involved in this information sharing network, again, we're trying to bring other states into the fold there. And we send the recap out. I send that to every state. So even if a state can't be a part of that monthly collaboration call, they're not going to miss out because they're going to get it in the recap. And so that seems to work out pretty good. Again, we then, after we let the federal agencies talk, we go ahead through each one of the states talking about if they've got stuff they want to share. And one of the most important aspects of this collaboration, this framework, is that if they have requests for information, they can put that in the form of an RFI, and it gets voiced during the discussion. But then I also put that in the recap and send that out to people with a follow-up that they can contact the requester directly with that information. Now, a great example is a couple of weeks ago, New Mexico State had a question about, in their state, they were having a problem with schools not wanting to do fire drills now because of the fact that in the Florida situation, a fire drill was used as sort of a diversion to complicate that situation. And so now they were reluctant to do fire drills. And Colorado State had worked with their fire marshal's office, and they developed a very good, sound guidance document on how to conduct fire drills in the current environment with the active shooter threats and things like that. So we were able to, through that RFI that New Mexico put out that I shared, Colorado answered that, made available what I consider a best practice document, and then we shared that with everyone through the conference call and through the recap. And we've done that again and again. I know back in 2014, right when we had this going, we had the Ebola scare, and we already had Ebola with some victims down in Texas. I believe it was Houston, and we were discussing that already in October in our conference call line. And again, the federal agencies, it's not intentional, but because of bureaucracy, et cetera, they're sometimes slow to get ahead of the curve. So we are already discussing some best practice guidelines that the health department in Texas had, that the CDC gave to the health department in Texas already in October. Ed didn't go out with any guidance to the schools until December 16th. When Arnie Duncan, the Secretary of Education, finally sent out an all schools letter about Ebola guidance and some links to stuff. So we try to, through the NSSA, because we're not part of a government bureaucracy, we're just kind of flying by the seat of our pants. We're able to get ahead of some of these unfolding situations a lot quicker than some of these federal agencies can. And that, again, I think is the value of having kind of a grassroots-driven, informal information sharing process or strategy. It's all about making sure that the people get timely information, best information, accurate information down to the state level, and then let them push that down to the local schools through things like maybe putting it on a website, maybe putting it into an email dissemination, or however they do that. But again, let them figure out how to do that. That to me is sustainable, letting the states figure that out. It's not sustainable trying from the federal level, figuring out how we're going to get connectivity to every individual local school. And so that's kind of been our push for our vision for the National School Safety Alliance, and what we're going to continue to push the various agencies to identify, to embrace. We still got a lot of work yet to do, I think, as far as information sharing framework. I see every day we have failures and breakdowns. And it's all about communication. If you look at the situation in Florida and all the different systems that fail there, and while the burden goes back to the young man that did the shooting, he was the one that caused it, but there was a lot of system failures there. And if you look at 90% of those system failures, it was all about failure of communications. And so if we can figure out a real way that we don't have those communication failures, we're going to solve a lot of our problems. It isn't about throwing millions of dollars at this problem. We've just got to change our culture. We've just got to change our attitude to do better stores of positive information that we can share that will make a difference in people's lives, make the quality of life better at schools, the school climate, school culture, and then make this safer and more secure at the school level. I tell people again, we've got to focus on what this is about. This isn't about school safety. That isn't the end game. The end game is creating an environment in our schools so that every student, regardless of their abilities, can reach their full potential, and that there's nothing in the area of school safety that holds them back from realizing that potential. That's what we got to focus on, those individual students, and making sure that they have that environment that is the best environment possible, that's nurturing, loving. And if we can do that and focus on that, we will have safer and more secure schools. I think I probably talked enough here. Again, if you've got any questions about this, I'll be glad to answer them now. I should have my email information on the last slide, which you can put up if you want. Again, I serve as the administrator for the National School Safety Alliance. I serve as a senior policy advisor for the Missouri Center for Education Safety. My phone number's there. A couple of my email addresses are there. And again, I tell people that I'm available 24/7, 365. I basically, I'm working for the kids of the country. I basically, nobody pays me for anything that I'm doing right now. I'm pro bono in both those positions. But again, it's what it's about. It's what makes life worth living, I think. And I think, again, there's a lot of people with a lot of passions out there for school safety. We need to tap into some of those passions. And if we can do that, we're going to be better off. And with that, I'll end here. Thank you.
Perfect. Thank you so much, Paul. We really appreciate you taking the time to join us. And I will say there, NGA very much is, we are very passionate about this issue and recognize our opportunity as a collective to really make a difference and look at that whole holistic approach. One of the reasons why the Education Division has really, we're moving very quickly on this issue is that one of our 5 initiative areas is whole child, really looking at the supports, the systems that need to be in place so that kids are happy, healthy, and ready to learn in a school environment. And so thank you very much for your time, for your comments. We will certainly make sure that we not only push out the PowerPoint materials, the recording for this call, but some of the resources that you mentioned as well. We'll ensure that we get those out to the policy advisors as well. With that, we would like to turn to the listening session of our discussion today. We have developed a handful of questions as we've been traveling and talking to states and states reaching out to us. And there are some questions that have come up through the states, but also as a broader collective that we have as well. One of the first to really help us think about and guide our work is how has the discussion around school safety and prevention evolved in your state? And what is the primary focus? And again, I want to reiterate Jeff's point that the conversation around gun laws specifically will be addressed March 22nd. Really the focus and role of the Education Division is to look at this discussion from the site-based or school-based perspective. Over the course of the last few weeks, we have heard everything from looking at in-school support, such as what professional development needs to happen for teachers. We've heard about what types of interventions and supports are best for children that are at risk. We have heard everything from one particular state, they're starting to look at their school resource officers and what the eligibility criteria is for the school resource officers. And so from our perspective, we would love to hear from you as far as where the discussion is moving in your state to help us better determine the types of support or what division might be the best point of contact. So with that, I'll pause for just a moment and you can either raise your hand to speak or use the chat box or email option. So one of the, it is not a question, but a comment that was posed that school resource officers as well as restorative justice training have been key points in school safety discussion in Rhode Island. Thank you, Kevin. We are going to go ahead and list the other questions and we'll hold them up for just a moment. We are very interested in hearing about some of the different challenges that you may be having regarding urban districts versus the rural districts. This came up in 2 of our states that have pretty much most of their districts in rural communities, looking at particularly schools that have an emergency response time of 30 to 50 minutes and how they're addressing school safety in the rural piece. Also, from a school finance perspective, how this increased school safety is potentially impacting state and district budgets around insurance liabilities. So these are just a couple of the questions that have come up that we would like to have an opportunity to hear from all of you.
So we just received a comment from Wisconsin. So Wisconsin has heard concerns about mental health professional shortages, especially in rural areas, both for schools and its private providers of mental health services. I don't know if any other states want to weigh in on the similar challenge.
I'm sorry, are we muted or? We're unmuted.
We've also heard from Colorado. So Colorado recently passed, or not recently passed, the Clear Data Act, which has caused some concern among school districts from an insurance and liability perspective. The act imposes a limited waiver of sovereign immunity for schools if a school fails to exercise, quote, reasonable care to protect all students, faculty, and staff from, quote again, reasonably foreseeable acts of violence that occurs at a state school or at a school-sponsored activity. It's a very big challenge there. Any other states want to weigh in while we have the floor? Thank you to Colorado and Wisconsin for sharing.
So, Brian, we do see your question. We'll circle back in just a moment, or your comment. We wanted to turn it over to Hamey, the Division Director for Health, who is going to talk a little bit about the mental health professionals in rural areas.
Yeah, no, and that's and thank you for raising that. I think that's a great point. We've actually done a fair amount in our workforce space, and when we've identified and rural project, actually we just launched a rural project last year, and we expected a lot of people to come in and say, oh, we're worried about hospital closures, and the biggest thing they raised was we don't have access to behavioral health services in rural areas. Mm-hmm. So we've spent the last year really thinking through what are alternatives, and really the things that we've uncovered is really through telemedicine and teleconsult ideas, where you're able to, have a hub perhaps in an area that has been more populated, where you have some mental health expertise, and then you can, beam out essentially to the more rural areas. So glad to follow up with you as needed.
And we are going to unmute Sandra, who's a program director for health. She's also going to chime in on this issue. Sandra, you're unmuted.
Sandra, we can't hear you. It might be maybe you're muted on your end. Okay, we might have to come back. Unfortunately, I can't hear.
Yep.
So now I'll turn to a comment, sorry, Sandra, from Brian from Delaware. Will you scroll up for me so I can see it? Or down. So Delaware has created a school safety communications platform involving their Homeland Security Office, Fusion Center, and Department of Education, and also SROs are locally funded in Delaware. I don't know if any other states want to weigh in with similar actions that they've taken. We also have a comment from Maddie in Washington. Thanks, Maddie. So Washington is about to pass the state budget. One provision directs a work group on mass shootings with a sorry, with a focus on school safety. Past efforts include school mapping, that has been funded. School safety experts would like more resources for school safety planning. Their state budget has also funded a professional development module for school staff to recognize signs of student distress. Maddie, I don't know if we can unmute you. I would love to hear more about that last piece if possible. We're gonna, oh, you're not on the line. Can't be unmuted. We'll circle back with you on that one, Maddie, because we'd love to learn more about that. Any other comments? So one more from Maddie. Is she can she be unmuted? No. Okay. So she should. Yeah. Maddie also mentioned that their state OSPI has a school safety advisory committee and convenes an annual school safety summit. All right, Maddie, you are unmuted.
Yes, we have these efforts. Our advocates for school safety are requesting more resources for school safety planning. Regarding the module for school staff, that's been modestly funded just to develop the module, and the professional development component, that would be up to school districts to include it in their professional development. So, yeah, is there anything else you'd like to know?
No, that's extremely helpful. Thank you. I don't know if any states had any follow-up questions. Feel free to raise your hand or we can pose them for you. I'm becoming very good at reading off questions, I've discovered. And so we've unmuted Sandra, who's going to weigh in on our question from Delaware from earlier.
Hi, it's Sandra. Can you hear me now?
Yes.
Oh, good. Thank you. I don't know if the folks from Delaware want to, or if you all want to repeat Delaware's question, just so I can be very specific, because I have a lot to say about the mental health piece.
Sure. So Delaware has created a school safety communications platform involving their Homeland Security Office, Fusion Center, and Department of Education, and SROs are locally funded. The wrong question.
SRO.
Right question. Yeah. Oh, sorry. I'm sorry. Wisconsin question. That was my bad. That's right. So sorry. So Wisconsin has heard concern on the mental health profession shortages in rural areas, both for schools and as a private providers of mental health services.
Okay, I caught part of that about mental health workforce in rural areas, and it sounds like a question there is about key partners and how to build out those community linkages that are so critical to doing this kind of prevention, identification, intervention work early rather than later, if I'm understanding the question correctly. And Hammy already referred to a lot of the good work that we're doing in the rural areas and tele-solutions to help build out the workforce shortages. But there were a couple key partners I think worth highlighting. It's probably less common that you'll have school-based health centers in rural areas, but to the extent they exist, certainly those in the secondary schools are doing a lot around integrating not only primary care and oral health interventions, but behavioral health interventions have a lot of really innovative tools and ways to engage kids at that age early and often, and do some informal and formal assessments and screenings of kids. So that's one way to build it out. Another is that most states have systems of care. Those systems of care include all the community partners you could imagine on the human services, social services, behavioral health, and health sides of the equation that help support children and families. They're typically geared towards kids that have already been identified as having some social emotional challenges. So that's number one, if you already have that. Number two, if you haven't identified those kids, it's still worth taking a look at how those linkages have been built and how those systems of care operate, because I think they'd be critical to helping you build out an infrastructure and augmenting the partnerships you already have in place and looking for unique solutions, especially in those underserved areas. So those are just a couple of things to highlight. I'm happy to talk to folks more offline about different opportunities.
Yeah, and Sandra, I think one of the things that, just for a clarification, I think they were specifically asking around mental health professional shortages in rural areas, both for the schools and for private providers. So I think the schools is the question, and I don't know if you have any thoughts sort of off the top about, how schools specifically address it. As you said, school-based health centers are more rare in the rural areas, and so what are ideas around for the schools, what they can do?
Yeah, happy to look into it more because I certainly don't have an exhaustive list, and that's probably why we have a lot of challenges in rural areas.
Yeah.
But the short answer is going to be using resources in multiple ways rather than perhaps being able to build in a school psychologist in each school in those areas. How can you use the existing community resources to do in-reach and make those connections back out to the community supports with the private providers or even public providers that exist in the community? There are more resources in the community that can be brought into the schools to help augment what exists currently than perhaps building out a new workforce, embedded in each school right off the bat. But I'm happy to talk through more ideas with folks offline.
Yeah, and one thing I would add, this is Amy, two ideas that came up in some of our work in Nevada actually was building in some supports through like after school programs that have behavioral health expertise, just in terms of like building on like what you have currently in existence. And although we didn't really focus on schools in our rural health project, I'd be curious to see how the telemedicine solutions can map onto things that are happening in schools.
Just two other quick things to add on to that as well. There's some communities have been doing some work around mobile units that are going around to schools to provide additional services. And then another piece to add on is trauma-informed care training or trauma-informed training for staff to help them better support the needs of students that aren't necessarily that full mental health provider, but are kind of that intermediary step to identifying needs and helping to connect to some of those community resources.
Thank you, Akisa. And actually, that's one of the pieces that we've heard. There's one trend that continues to come up with this, and I think that is something that as NGA develops this framework, are the challenges between rural and urban. From a resource perspective, from just capacity, I think that is one thing we'll have to really be clear in addressing because the challenges are certainly different, urban to rural. So that's a good note.
Yep.
And as we continue to get questions of what types of supports and professional development can be offered to teachers and parents and communities, thinking about that from both the education side and integrating trauma-informed care, the ACEs, all of that into the discussion as well. So very helpful. Do we have any other questions? Nope. All right, so what I would like to do, we have just about 8 minutes left, is to go over the survey that will be pushed out at the conclusion of the call. The NGA team has been working really diligently to think about what types of supports we should offer. And so we had an opportunity to sit down, and when you receive the survey, there will be it's a total of 5 questions, so it's really short. You can click multiple options, but there will be an opportunity for you to select which areas of interest that you might want additional information, support, and then we are going to be working collectively as we receive the data to really help frame our approach and individualize the supports to the states based on the conversations. So you'll see education, homeland security, and health. And then also, we'd love your feedback regarding just the call today. Depending on how the survey results come back and the types of questions and resources that's needed, we may have another follow-up webinar on this issue. Homeland Security has their webinar March 22nd. And so we're really looking forward to that discussion that will be focused more specifically on the policies around gun control. And then also we are available for general questions. We recognize that on this call we have representation from various governor's offices in different roles. If you would like to email any questions to education@nga.org, that email address goes to our general inbox, which 3 people check daily. We can then triage your question and forward your question out to the appropriate NGA staff. We want to make sure that we get you connected to whoever can answer your question more specifically. So thank you very much for your time today. The survey should be coming out within the hour, and we look forward to continuing to support all of you as you continue to do this work. So thank you all for your time, and have a wonderful afternoon.